Developing countries like India are facing a double burden of communicable and non-communicable diseases. Brain stroke is one of the leading causes of death and disability in India. There has been more than 100% increase in incidence of a stroke in low and middle-income countries, including India, from 2008 to 2018. Indian Council for Medical Research, ICMR, states that a person suffers from a brain stroke every 3 seconds in India and a death is reported every 3 minutes. This statistic reiterates how crucial it is for such patients to have access to timely treatment.
I work in a private firm. After I reached home from work and was getting fresh, I saw my wife had fainted and was unconscious. After watching that, I had no idea what happened to her and was confused to take action at the moment. Then I decided to take her to the nearest hospital. After visiting the hospital, the doctor informed me that she is suffering from a stroke and has to be rushed to a good hospital.
Patients with a brain stroke need to be taken to the hospital in the first hour of getting the stroke, also called the golden hour. During this time, there is a 4.5-hour window for treatment, which needs to be administered to the patient on an urgent basis. Schiller India, in collaboration with Neurologica Corporation of USA, has been proud to deliver the first mobile stroke unit of India at KMCH Coimbatore. These specialized ambulances have made the diagnosis and treatment of many neurological emergencies, in addition to ischemic and hemorrhagic stroke, a possibility at the emergency site. This has resulted in faster treatment for patients with acute neurological emergencies in the pre-hospital stage, giving them a fresh lease of life. The mobile stroke unit is a specialized ambulance that consists of a CT scanner and laboratory equipment essential for the diagnosis of a stroke. It has a team of paramedics and a CT scan unit.
This vehicle has got 3 main areas. This is the area we showed you, which goes inside for the doctors and the technicians to enter, handle the patient and do the CT scan. The second area is this, which has got the oxygen cylinders and also has got the outdoor unit for the air conditioning system. This is an isolated unit and the batteries are above that, which is necessary to run the CT scanner. We have again another compartment which handles the generator. The generator is necessary for us to run the air conditioning. Also, it is a backup in case the battery fails while doing a CT scanner. This is a mobile CT scanner, which is the heart of the machine. This is what will do a CT scan on the roadside in a remote village, so that we can diagnose whether the patient has bleeding inside the brain or a blocked vessel. Once the CT scan is done, the images are transmitted from the ambulance to the main center. This is like an ICU. This is a ventilator. This is the monitoring device. This is a defibrillator. We have got everything that an ICU needs to resuscitate a patient. Now this lift is necessary to ensure that this stretcher can be removed from the ambulance. This problem does not exist for regular ambulances, but in this ambulance we have taken this precaution to ensure this can go in a road which is bumpy, which other vehicles will find it difficult to go because it hit the bottom. So the stretcher is moved onto the lift, and this lift will now come down.
With the help of telemedicine and telestroke software, the medical staff present in the unit can send the CT images and videos of the patient to the hospital, where experts can support in diagnosis and treatment management. Patients lose no time during transport to the hospital, as a spot diagnosis and thereafter an immediate treatment can be initiated because of the mobile stroke unit. Health outcomes in stroke patients have been strongly correlated with time, from onset of stroke symptoms to restoration of blood flow. The sooner reperfusion is achieved, the more likely the patient achieves a positive outcome. An essential step in the evaluation phase of the process is performing CT scan of the brain and proceeding with therapy, which includes intravenous TPA in the ambulance within the golden hour.
The doctor then told me about an availability of a stroke ambulance. After getting this suggestion, I requested them to call for the stroke ambulance. The doctor also informed me about the availability of required injections and CT scan machine in the ambulance, which would help us in saving her life. After arrival of the ambulance, my wife was taken inside the ambulance to complete the CT scan. After the scan, the doctor informed me about the clot in her brain, which caused the stroke and needed to be operated. Once we reached hospital, everything was ready for a further treatment, which could save her life, as the CT scan was done in the ambulance itself.
Neurologists have often pointed out that stroke is a medical emergency, but time is critical for saving the patient's brain and lives. Using specialized mobile stroke units to assess and treat suspected stroke patients during emergency has considerably reduced the time taken by doctors to decide on the appropriate treatment.